Well, I'm joined by Minister for Health and Social Care, Mr. Howard Quayle, and you wanted to just talk about how things are progressing, and we want to talk to you about that. But you go first, because obviously you've got more changes. You've announced that more people are leaving, retiring, whatever, and you seem quite happy with the way things are going. Is that right?
Yes, I'm quietly pleased. Obviously, there's an awful lot more work to go, but we've got 3 key appointments made, and they are absolutely key. A new Chief Executive Officer, Mark Charters, he really has hit the ground running. Obviously, when I was advertising for these jobs, it's always in the back of your mind, are you going to attract people of the calibre that I wanted to take the health service and social care department forward? And I'm absolutely delighted to say that we have attracted a really top field.
You did promise to let us interview him, by the way. We haven't seen him yet.
Right, well, pick up the phones, speak to Jill, and I'm sure she'll set up a meeting. So, you know, we're not hiding him away. He's very good, you know, at that sort of thing, far better than me, so we've got nothing to hide there. Mark's happy to speak to anyone.
But you always get this thing when people move to an environment like this, it is so different, and there's been quite a few casualties along the way of people who haven't taken to the way the Isle of Man does things, and the way that there is so much political involvement. You know, it's different, isn't it?
Well, and obviously when you're interviewing, that is absolutely one of the key questions. You know, the new CEO, he's been living in he's lived and worked in New Zealand for a short period of time before he's worked in London Bexley Council, Southamptonshire, I think it's Northamptonshire. He's looking forward to the Isle of Man. Well, he's settled in here now. He's renting a house at the moment, looking to buy, but really has hit the ground running. I'm very impressed and very pleased. You know, Michaela Morris, the new Director of Acute Medical Services, she's over on the island at the moment, house hunting with her husband and daughter. And she met with us all yesterday. We took the top team round, a little tour around the island to look at the facilities that we've got.
West Midlands review, though, continues, and we haven't had a full marks on that one. We weren't expected to, I suppose, but are you taking everything on board that they're coming up with?
Yes, where there are changes to be made that we can make the changes, then we're going to act. I mean, I have to say that some of the when we get scored on everything as if we were an inner city hospital, so there are some areas that we will never pass. For example, a specialist heart surgeon, we do a certain type of procedure on the Isle of Man, and the rest of the procedures are done off island. Now, there's only 85,000 of us. We can never hope to have a consultant for every medical procedure known to mankind.
I think people accept all that.
Yeah, but unfortunately, we are graded as an automatic fail in that entire area because we don't have that qualification. Even though we apply it, we send the people to it, that gives us an automatic failure. So all I'm trying to say to people is, when you see some of the percentages not being as good as I would want them to be, there are areas where it's totally unfair on us, but there are areas where it's a fair cop. We need to improve our game, and we're putting in place those procedures.
And this goes on. This review is continuing.
This is a continuous review over the. Well, we're into the first year. There's another 2 years of this review.
But it did find some serious shortfalls so far, hasn't it? Forget about what you can't get scored for. Well, it hasn't been a bed of roses.
It hasn't been a bed of roses. However, it has. Anything that it red flagged up as an immediate concern, there was only one item in the latest thing. That was a technicality on cover for pacemakers being fitted of an evening. That was it. Right. That was the only cause for concern that needed immediate action, and that was a technicality that we sorted out there and then. And West Midlands are happy with that red flag concern. All the other stuff are things where they're saying you need to improve your service, or you need to do things slightly differently. And you know, we're putting forward together business plans to do that.
How can we keep affording this level of health service in a low tax environment? You know, at the end of the day, like places like Jersey, they charge to go to doctors and that sort of thing. You must be behind the scenes still worried about how much national insurance is coming in, how much the hospital's costing to pay. When are you going to put your head above the parapet and actually tell the public there have got to be more changes ahead for us?
Yeah, I've got 2 jobs at the moment. I've got to make sure that we're delivering a health service that's as efficient and cost effective as possible with the current model. So that's what I've got to do first, and when I've done that and got it there, then we're going to have to plan to provide a new health service and social care system that is affordable for the next generation.
Will we be charged to go to the doctors then? Is that on the list?
I'm not saying no. I don't have a list. We will have to come up with a plan on where we think we're going to have to go for the future. I don't want to bore people, but at the moment there's 3.2 people paying taxes for everyone over the age of 65.
And it's going to get less.
It's going to get down to 1.8 by 2040.
But that's my point. I want you to tell us that life will change, right?
And we are looking at changes to make sure that the next generation can afford to provide a health and social care service. And what we're going to have to do is get people away from the acute side of things more into the community. So I need to do more preventative work, and we had the stop go in the park project on Wednesday, where we're trying to get more people to exercise more.
Yes.
If we can catch people young that not to be overweight.
Okay, but can we get back to the fact of
Yeah.
how you've got to go into your council of ministers meeting with the budgets at the end of the year, and you're not ring fenced particularly. I mean, I know you've done quite well, but everyone's budgets can be hit. Are you happy that the Isle of Man, people watching this today, will have a happy retirement, and when they need the NHS, it'll be there for them in the foreseeable future, still be there as we know it?
In the next few years, yes, absolutely. But
what about longer term?
But longer term, we've got to put together a plan, and then it's my idea to go around the entire island, parish by parish, do a presentation to the people of the Isle of Man, show them the problems, show them the various solutions to that problem, and let them decide what they feel is the best way forward.
Do you know all the people that vote at the end of the day, the older people are the ones that turn out to vote for you into office and everybody else? They will demand, don't they, expect the service that the United Kingdom gets, even though the tax here is lower.
Yeah, but the United Kingdom has exactly the same problem as us, and it's not just the United Kingdom and the Isle of Man; it's the whole of Europe. This isn't a problem that's unique to the Isle of Man. Everyone is looking, or should be looking, at coming up with a solution to go forward, and I want to work hard and come up with that solution, but it's got to be something that we've got to explain to the people of the Isle of Man. I mean, you regularly see articles in the Telegraph and the Times that think tanks are saying you should pay £20 whenever you want to go and see your doctor. And in fact, I had a doctor on the Isle of Man say that if he charged £5 for every patient that he saw, he would have probably a third less people coming to see him because they are wasting his time with trivial.
Are you happy with the list? I mean, dermatology is still a problem, is it not?
Yeah, I'm not happy with the waiting lists as they currently stand, but I just ask people to bear with me. I can't wave my magic wand and bang, the waiting lists are gone overnight.
When will they go?
It's going to take me a couple of years to get the waiting lists.
A couple of years?
But in that interim period, there will be some significant improvements, and dermatology is one where I would hope within 12 months where there will be a significant reduction in the waiting lists.
Are you publishing facts to the public still? I mean, on the websites, do people see the list of how long they're going to have to wait for?
I'm not so sure whether we have an exact waiting list on. People are told when they go into the appointment, this is the waiting list.
What would you like to see as an ideal waiting list time?
I would like to match the UK on the waiting lists.
And we don't.
We don't. And in fact, I'd like to get better. I don't want to say I'm trying to keep up with the United Kingdom when the health service I want to deliver and a social care service, I want us to be better. That's my target that I'm setting to the new management team.
It leads back to costs. How are you going to be able to afford this?
It's got to be done within. We've got to live within our budget, Paul. And at the moment, in the last 2 years, we've seen a 50% increase in the cost of sending people off the island. Now, we look at wet macula. I've said I'm going to deliver that service on the Isle of Man, and that will. But I'll do it at no extra cost to the public. And that's why you can't just throw a couple of £100,000 or £500,000 to get a service done and then the problem comes back 6 months later.
Well, you get millions of pounds for a computer system and that went through. So obviously Tynwald is pretty well on your side for funding purposes, is it not?
But we don't have the... if you gave me an extra £20 million, Paul, in the health service, I could spend it rather quickly and rather easily. We've got to make sure that we get value for money with the money that we've got at the moment. And I am convinced that with the new team of strategic thinkers that we're putting together, we will join up the services. At the moment, I think we're a little bit too insular, ivory towers for want of a better word. And if we can come together as a proper department,
And that was being the main criticism, wasn't it?
Yeah.
Up there, entrenchment that was going on up there.
That's right.
Morale was low.
Yeah.
Has that improved?
Well, you don't.
And would you know?
You don't suddenly improve morale overnight. I think when the staff see I'm bringing in a new team, we're making changes, we're listening to what they've got to say, then I would hope that over a given period of time, morale will start to come up again. But it's not something I'm going to be able to do overnight. But you've got to get your foundations right, Paul. You've got to have your people at the top right. And once you've got your top team in place, they can start to bore down into the various areas where the improvements are needed and do a joined up health and social care service.
Dare I use this whole expression that if it goes wrong at the top, will you fall on your sword?
Well, the buck stops with me, doesn't it? I have come into politics to do my very best. I was asked to take on health and social care. It's the biggest department in government. People could say it's got the most problems in government.
So you would fall on your sword if it all went wrong?
If it all went wrong, yeah. I'm not. It's not going to go wrong.
Right.
But I would. I'm not a career politician. I don't see myself as a career politician. I came into politics to do my best for as long as the people wanted me, and the family are happy for me to do it. But if I'm 70 and still in politics, I'll feel a bit of a failure. I want to genuinely do my best, and this department has problems. They're well documented problems, and I'm going to work hard I am working, not going to. I'm working flat out with the new team to turn things around, and I'm quietly confident we will deliver. But I just ask people to bear with me. I got one particularly unpleasant email that I'd been 3 months in the job, and why on earth hadn't I sorted the problems out by now? And it's not something you just cannot wave your magic wand and sort out the health and social care department in 3 months. You make the changes, but those changes are going to take a while to happen. But I think if you and I have this conversation in 12 months' time, I will be able to say, well, I've delivered on this, that and the other, and there will be real changes that people of the Isle of Man will see.